and Metro Coronavirus Task Force. We're joined today by Samantha Williams, manager of the Financial Empowerment Network at the United Way of Greater Nashville. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of Public Health, are here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. Yesterday, the United States surpassed 150,000 COVID-19 related deaths, a grim milestone in the face of this global epidemic. Now, this is the equivalent of the entire city of Murfreesboro, Tennessee, disappearing over the course of 5 months. The toll is more than the U.S. deaths in 3 Vietnams. Now, in Tennessee, over 1,000 lives have been lost to the virus to date, and Nashville's COVID-19 deaths accounts for nearly 1 out of every 5 coronavirus fatalities in the state. Our fatalities compel us to take action. If you do not wish to abide by the rules, you can stay home. Those of us who engage in civil society must continue to fulfill our responsibilities to wear masks, socially distance ourselves, and protect one another. Now, technical difficulties yesterday with the state's COVID-19 database prevented Metro Public Health from publishing our coronavirus numbers, but they are available as part of today's report. And this morning, we are reporting 411 new cases over the past 2 days. Our 14-day new case rolling average remains in the yellow, but it has moved down to approximately 312 from 342 on Tuesday. Our transmission rate has also fallen slightly to 0.96 from 0.99, and Nashville's 7-day positivity rate is now at 13.1%, down from 13.3% 2 days ago. Masks are clearly having a positive effect in Nashville. Now, 16% of floor beds and 12% of ICU beds are currently available, which places both metrics in the yellow caution category. Dr. Jahangir will provide more details on our COVID-19 benchmarks momentarily. Now, as I said on Tuesday, we cannot relax our posture as individuals or as a community. Each person who does not wear a mask in public can jeopardize our reopening plan. Every family who chooses to delay a large birthday party or anniversary celebration can also advance the success of our small business recovery while also saving lives. Make no mistake, we are in this together. Now, once again, we will remain in a modified phase 2 for the time being. The 10 p.m. closure of restaurants in Davidson County will continue until further notice. The temporary closure of all bars, limited service restaurants, and transportainment vehicles across Davidson County will be extended at least until midnight on the evening of August the 16th. Now, a new federal report has declared that Tennessee is among 21 states identified as red zones, those states that have more than 100 new cases per 100,000 people during the week preceding July 24th. Now, to no longer be declared a red zone, the state would need to reduce its daily new case numbers by more than half, from over 2,000 to less than 1,000 cases per day. In Nashville, we would need to reduce our daily number of new cases to less than 100 per day to meet the same requirements. This is a level of new cases we haven't seen since early June. Now, as I've said, though we've seen signs that our response may be working, we've got our work cut out for us. Again, Nashville is not an island. We cannot contain the virus alone. And every county for its self-response, where counties separately must self-align on a public health standard, may result in a stalemate in our fight against COVID-19. During her visit to Tennessee this week, Dr. Burke strongly warned that based on the federal government's findings, mask mandates, bar closures, and social distancing measures must be in place statewide to control the spread of the coronavirus. Nashville has taken these steps on our own, but a public health crisis of this magnitude requires a consolidated approach. And where the federal government has not delivered a national standard or strategy, A coordinated statewide response is required, and we will continue to push for that coordinated effort here in Tennessee. Our testing capacity remains robust at nearly 18,000 diagnostic tests performed per week in Davidson County, far exceeding our testing capacity goal. And as I mentioned on Tuesday, we and everyone in the country should be concerned about test result delays. In the meantime, if you receive a COVID-19 test because you had symptoms of the disease, or have come into contact with someone who has tested positive, you should take steps to quarantine yourself before your test results arrive. This is the responsible thing to do for your family, your friends, and community. Remember, Nashville, don't share your air. Compliance with Metro's mask ordinance is our fastest path to recovery. If 8 out of 10 Nashvillians wear a mask, we can contain the virus while avoiding a complete economic shutdown. An important measure of our progress is whether or not our children can safely return to school. As a red zone, state and city, as identified by the White House, reopening schools in person while a designated red zone is too much risk for our children and our teachers. As long as 100,000 children must stay home for fear of the virus, it is very important that we all do our part to slow the spread of COVID-19. You can receive a free mask by visiting the Lentz Public Health Center Monday through Friday from 9 a.m. until 3 p.m. The Community Assessment Center at 2491 Murfreesboro Pike in Antioch is up and running again this morning following repairs from this week's storm damage. The site will be closed on Election Day, Tuesday, August 4th, as the building at this location serves as an important logistics facility for the Davidson County Election Commission. Normal operations will resume on Wednesday morning, August 5th. As a reminder, state regulations precludes the authority of Metro's public health ordinances from any polling location within Davidson County. But we urge everyone to wear a mask and practice safe social distancing, both immediately before and after the voting process, to help ensure your safety and the well-being of those around you. And remember, today, July 30th, is the deadline to submit your mail-in ballot request to the Davidson County Election Commission for the August 4th election. You can scan your completed request form and mail it to MOA-Ballot at nashville.gov, and that's MOA-Ballot at nashville.gov. You can also fax your form to this phone number, 615-880-1729. Now, this morning, it's my pleasure to welcome Samantha Williams, manager of the Financial Empowerment Network at the United Way of Greater Nashville, who's here to discuss the free one-on-one financial counseling appointments available to all Nashvillians during this challenging time. I encourage everyone who may be facing financial hardship to make use of the Financial Empowerment Center by calling 615-748-3620 or visiting fec.nashville.gov to schedule your free virtual appointment today. Now I'll turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 20,893 confirmed cases. That's 411 new cases since our last update. There are about 190 people currently hospitalized in Nashville hospitals with COVID-19, and our rolling average is 312 new cases per day. That's down 73 cases per day since Thursday. Now, average is stable and heading in the right direction. However, it is still pretty high, and we need to bring it down further. The doubling rate, or the amount of time it takes for this virus to double, is now 41.6 days. Anything above 14 days is good, and this is the highest our doubling rate has been since the beginning of this pandemic. A metric that we are looking at closely is the number of daily new cases per 100,000 residents. This allows you to compare how Nashville is doing with other cities. More than 25 new cases per 100,000 is considered severe, and when it's under 10, nursing homes in the state of Tennessee can allow visitors. This morning, our number is 36.4 daily new cases per 100,000 for Davidson County. This puts us in the severe range. However, it is improved from where we were 10 days ago, which was 65. The virus is affecting all parts of our city. When you look at the heat maps, you see some areas have more cases than others. However, all of the city is impacted. A reminder, the heat map shows where an individual lives and not necessarily where they got the disease from. This is not just a downtown Nashville problem, nor is it just a southeast Nashville problem, nor is it a northeast Nashville problem. It is all of Nashville and all of Davidson County. So some areas of town may get more attention, get more press, and you think the virus may not be in your neighborhood, but it is. It's spreading when you're letting your guard down. One area of concern is gathering of friends and relatives. You may think it's safe because you know everyone. They're your quarantine friends, right? So they don't have COVID. Well, don't get lulled into that kind of thinking, because what we are seeing is gatherings can easily become super spreader events where multiple people or an entire party gets infected. So if you do socialize with friends and family, ideally we want you to keep your group under 25. Keep your distance, don't share your food, and have your own cup, plate, and utensils, and condiments. When we let our guard down, this is when the virus spreads. So please keep your focus and keep your guard up and keep doing what you're doing to stay safe, because it is making a difference as you're seeing biometrics. A couple of notes. The 3 community assessment centers are open today until 1 p.m. And in preparation for next Thursday's election, the Election Commission will need access to equipment stored at the Kmart site all day on Tuesday. So the Kmart assessment site will be closed next Tuesday. It will open every day other this week and next. And Conexión America, with the support of Metro Public Health Departments, have launched a Spanish hotline. The number for that is 615-326-9986. Again, 615-326-9986. It is open Monday through Friday, 8 a.m. to 8 p.m., and on the weekends from 8 a.m. to 6 p.m. This is in addition to our other hotline that we have had now since the beginning of the pandemic. I'm very grateful for all you are doing, Nashville, and thank you. I now would like to introduce Samantha Williams.
Thank you, Mayor Cooper, for having me, and good morning, Nashville. I'm here to tell you about a tremendous public resource, one-on-one financial counseling. The Financial Empowerment Center is a long-standing partnership between the Mayor's Office and United Way of Greater Nashville. We provide free, professional financial counseling as a public resource. As part of Nashville's coordinated COVID-19 response, we've started to offer our services completely virtually, so you can have a phone or a video chat. We also are increasing our staff capacity. Mayor Cooper gave the phone number and the website. I'll give it again at the end. So no matter if you've been hit hard by the economic fallout of the COVID-19 crisis, if you have chronic financial issues, or if you just want to know that you're on the right track, our financial counselors are there, no matter your income level or financial situation. They're there to help you find a way forward. Our professionally trained counselors can help you create a budget, manage your debt, increase your credit, increase your savings, or help you access additional resources in times like now. We have counselors who speak English and Spanish and have interpretation services in almost every other language. The Financial Empowerment Center is here to help you navigate a complex financial system based on your needs and your goals. Lately, that's meant helping clients create a lot of bare bones crisis budgets. It's meant helping them find out what their options are with their creditors, or making sure that they take advantage of every single resource out there before they resort to credit cards or personal loans or taking money out of their retirement. Please know that as a last resource, there is help available. Now, the Financial Empowerment Center doesn't provide direct financial assistance, but we do have access to people who can. If you need access to basic needs like food, shelter, or direct financial assistance, please call United Way's 211 helpline. Again, that's just 211. So the thing about FEC counseling is that we know that it works. Over the last 7 years, our counselors have helped 8,000 Nashvillians reduce their debt by $15.3 million and increase their savings by $3 million. It isn't easy, but our professionally trained counselors, again, are there to help people find a way forward. We know that Nashvillians are struggling right now. We know there's a lot of economic uncertainty. We need you to know that our financial counselors are here to help. To schedule your free virtual financial counseling session, please call 615-748-3620 or visit fec.nashville.gov. It may not be you that needs a financial counseling appointment, but certainly there's someone that you know that could benefit from it. You can also find us on Facebook and Twitter if that's the way that you share with your social circles. Thank you.
Thank you, Ms. Williams. We'll now begin taking media questions, starting with Nancy Amons at the WSMV. Nancy?
Hi, thank you for taking calls today. Yesterday, we learned from the Federal Department of Education that the state was getting a $20 million grant. Has the Lee administration told you in any way whether Metro is getting a share of that money? And a question for Mayor Cooper, please. He's been very diplomatic in not publicly criticizing Governor Lee, but on a scale of 1 to 10, what is his frustration level for the governor not backing and following Dr. Birx's recommendation? Thanks.
Thank you, Nancy. Mayor Cooper.
Thank you, Nancy, for the question. I don't know the details of the $20 million grant from the Education Department. There is a lot of money flowing from Washington to the state and to us. The rules and the regulations on it do seem to change daily. So I know people in Nashville are frustrated about what we can afford and what we can and who's paying for what, but it's all part of this unprecedented part of the pandemic. As to your other question, on a scale of 1 to 10, I am 10 frustrated with the virus and getting us to the next size. I am not that frustrated with the state. States and cities always have their own relationship, and I don't think anybody cares more about Tennesseans than Governor Lee does, and I respect that. We can have a policy disagreement on whether there needs to be a more coordinated response, and I think it does. And the reason that we come here and advocate for that is I do think materially it will reduce the number of cases, hospitalizations, and ultimately lives. And I do hope that the state will see it our way. And that's not to say that individual counties have not shown a lot of responsibility when they've had to self-align on a standard. And I do think that we can advocate for that because I think we in Nashville are a demonstration of showing progress. You know, it's fantastic, our transmission rate beginning to tick down. Now we just have to stay at that. It's going to be a little bit, I mean, what we really would prefer is a national standard, of course, and that would really have made the whole response to the pandemic more easily. But we will succeed as a city, and again, optimistically, I want to say we are showing evidence of stable but serious.
Ian Jung at the Tennessean.
Good morning. Last week, state health officials provided an average test turnaround time, not including shipping time. Can you do the same for Metro, and what has been the average clearance rate for contact tracers? And my last question is for Mayor Cooper. Is he supportive of expanding the capacity of existing Metro programs run through the Metro Action Commission or social services to give more services and aid to our residents? Thank you.
Thank you, Ian. Dr. Jungier.
Thank you. Regarding the turnaround time for tests prior to contact tracing, I believe that's the question. The numbers you get from the state include all the different labs that do testing in the state, right? So Path Group does our assessment sites. We also have another lab we're working with. So you can get that answer directly off the state because their turnaround time is maybe up to a day and a half, 2 days. So I don't have that exact form in front of me right now. Regarding contact tracing, public health investigations, We are still, and about 75% of people are contacted within the first 24 hours. Now, obviously, we'd like to get that up to in the 90s where we were. But I will tell you this: you got to think about now when we were averaging 100 to 200 cases a day, we were able to get in that 90% range. Now we're at 300 something per day. We are using other resources, outsourcing some services, or talking about that, using electronic means to get in touch with people. So we're working to get that average up, but I think right now it is in the upper 70s of how many people are contacted within the first 24 hours. But here's the other message I want to share. Everyone should take responsibility for this challenge in this virus, right? So if you test positive and you get your results earlier than the department gets there, then the contact tracer is able to call you. Listen, you know who you've been in contact with for closer to 6 feet for more than 10 minutes, okay? You can call those people. Now, don't make it a visit in person to tell them, but call them. Say, hey, I've tested positive. I think you should self-isolate and go get tested if you're symptomatic. Every individual has an obligation to take care of their neighbor in this crisis. So I appreciate, and the people who do our contact tracing are really dedicated, but every individual needs to be dedicated to doing that. So please take that message as well. Thank you.
Thank you, Johan. On the question of the Metro action, having more resources to help our residents, of course, yes. We need them, and however, standing here today, it is unclear whether there's a second federal response or not. When is it going to happen, and how robust will that be? Also, the state response from the first federal response is not clear. What are the reimbursement rates? I would urge the state to remember that we in Davidson County are taxpayers too. We have had more disease and probably more economic dislocation here in Shelby County than in any other state, and to take that in mind when it comes up with its rules for what it is willing to reimburse us for as we help our citizens.
Before we continue, I'd like to make one correction that was brought to my attention. The Community Assessment Center at 2491 Murfreesboro Pike in Antioch will be closed on Tuesday, but Election Day is Thursday, August 6th. So if you're going out to the polls to vote next week on Election Day, that is Thursday, August 6th. Next question is from Kathleen Suri at Fox 17.
Good morning. Thanks for taking our questions this morning. So we know that the Metro COVID-19 Financial Oversight Committee is meeting today to discuss recommendations on how to spend the rest of the CARES Act funding. Can Mayor Cooper give any insight into how the funds could potentially help our families who could be at risk of eviction coming up on this Friday, and who could also possibly be facing, missing out on the rest of the federal funding that came from unemployment? Thank you.
Thank you, Kathleen. Mayor Cooper.
Well, eviction assistance is one of the major concerns. It's a very fine 9-person committee that I know will advocate for that and take it very seriously. Also, we have a community assessment process that is rolling out where individuals who feel a danger of eviction do need to contact us, and so that we can connect them with all the resources available. But eviction is one of the heartbreaking aspects of such a dramatic and steep economic decline that was reported today. A third of GNP disappearing in a quarter. It's beyond astounding. And I want to take this moment once again to say, wear a mask. That's what's going to get us back to work. 8 out of 10 Nashvillians. 8 out of 10 Nashvillians. We are making progress. We need to continue to make progress, and the way to put people back to work and to cure that problem is to have our economy recovered. And we don't need an inconsistent understanding of this. All parts of science, other states that have shown this. Dr. Birx herself came to Nashville to say, wear a mask. This is our way out of it, and being gravely worried as we are about the potential of evictions, that requires me to say this yet again, wear a mask. right? Prevent that from happening so that we can get people back to work safely.
Our last question today is from Harriet Wallace at Fox 17.
Yes, good morning. Excuse me. Just a couple of questions. My first question for Mayor Cooper, you said and stressed enough this morning about the importance of wearing masks and looking at the gains that we're starting to make, and even Dr. Burks mentioned some stabilization happening. When you look out and you see many people in the downtown area or just visiting here or moving around with no mask, not socially distancing, any message or warning that you have for them this morning? And then my second question, we've seen where Dr. Stella Emanuel has been making a lot of claims. This is for Dr. Jahangir. Making a number of claims that masks are not as effective, that the drug, and my pronunciation was going to be incorrect, hydroxychloroquine, I believe it is effective. And even President Trump has been touting her and even saying maybe replacing Dr. Fauci with her. Dr. Jahangir, when you hear those claims, your response to that, especially as you all try and get a handle on the virus here, any concerns with that messaging, which is counter to what you all are saying here? Thank you.
Mayor Cooper.
Well, thank you, Harriet, for allowing me to once again say it's very important to wear a mask. And as I said in my remarks, if you don't wear a mask, go home. You know, if you don't want to participate in getting our economy back and serving Nashville, then you have a choice. That choice is to stay home. And increasingly, an aware public, I believe, will be frustrated and create a self-enforcement environment here in Nashville. I think compliance has risen every week, but we have to have people understand it, because it's conceivably weeks and months ahead of us having to develop this as a habit, not because some government forced us to do it, but because we understood that it was our path for progress in keeping each other safe. That's why the education part of it is so important. You can't enforce your way into this level of public health responsibility, but we can educate our way. And the degree that the media or anybody else transmits a mixed message that allows people to engage in magical thinking, that it is not all of our responsibility to get this done, that is a problem, and they really should not be doing that, because only by unity will we solve this problem. That's a tough thing to hear, because it's not been our strength as a culture really lately, but this is how we're going to learn to be unified as a country again to get through this. So if you're not willing to wear a mask, I'm wanting to tell you to stay home.
Harry, thank you for that question. Regarding hydroxychloroquine, listen, all trials have shown it not to be an effective treatment for COVID-19. In fact, if I'm not mistaken, the FDA actually pulled any approval they had given for that treatment. So it's not an effective trial, or it's not an effective drug for that problem. So that's that. I mean, and these are smart people who have done studies around this. Regarding the physician who said some odd things, here's how I want to put it. If what that group of physicians was saying was so egregious that Facebook and Twitter literally pulled their statements off, and YouTube, I think, because they were that false, I think that should be what you should take. We are approaching this with science, with data. That is how the medical community is approaching it. That's how the mayor's approaching it. That's how the governors are approaching it. That's how other leaders are approaching it. So I honestly don't even want to speak anymore about those statements, because there's just 15 minutes of fame seeking. Thank you.
Those are all the questions we have this morning. I'd like to thank Ms. Samantha Williams for joining us today. The next scheduled Metro COVID-19 press briefing will air on Tuesday, August 4th at 9:30 a.m. Thank you for joining us. This concludes today's event.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.